obturator nerve, obturator artery. Lumbosacral trunk, L4, L5, S1, S2, S3 forming, sciatic nerve right here. I'll get back to the sciatic in a second. We're going to take off tensor fascia lata, and we're going to take off rectus femoris. Actually, we'll take sartorius off first. Then we'll take off rectus femoris, because here's your femoral nerve. Femoral nerve is the bigger branch going that way. It's going to innervate all the muscles of the anterior thigh. Saphenous nerve is running down here into the adductor canal along with the femoral artery and the femoral vein. Coming off of it, this is your medial femoral circumflex. This is going to be the profunda femoris or deep femoral, okay? Come around here. I said what we got here. Then your sciatic nerve is going to be coming out in all of its glory. Sciatic nerve comes out under piriformis, goes down the back of the leg, splits into tibial and common fibular around the area of the popliteal surface of the femur, just as the femoral artery and vein go into the adductor canal. They come out and they are then popliteal artery and vein. Tibial nerve is going to continue down the back of the leg. Common fibular is going to go around the head of the fibula. Over here, just as a reminder, we've got your geniculars. Superior medial genicular, superior lateral genicular, or I got that backwards? No. Where's the little toe? Yep. Inferior medial genicular, inferior lateral genicular. Underneath there would be that little medial genicular, which you really don't see too well on the table. Tibial nerve will continue down the back of the leg with the posterior tibial artery. It's going to go in the area of flexor digitorum longus, flexor hallucis longus. Deep to them is tibialis posterior. Over here is popliteus. We come around to the front. Here is your common fibular nerve. Common fibular nerve is going to innervate fibularis longus, which you could see running underneath the foot here. Fibularis brevis goes to the base of the fifth metatarsal tuberosity. You're also going to see tibialis anterior, extensor hallucis longus, extensor digitorum longus going to 2, 3, 4, and 5, and fibularis tertius, fibularis tertius coming over here, okay, to fifth metatarsal. That's fibularis longus, that's fibularis tertius. All four of these are innervated by deep fibular nerve. The common fibular will split into superficial, like I said, innervating these guys. It then becomes cutaneous to the dorsum of the foot. I'm going to go into more detail on the foot model in a second. The deep fibular is going to be innervating all the muscles of the anterior, and it's going to be running with the anterior tibial artery here, okay? And that's all we got on that guy. Stop playing footsie. Foot model. How do you know which one is tibial, which one is sural? Can be confusing. Tibial nerve is running with the posterior tibial artery. Sural nerve running all by itself. No artery with it, okay? Again, superficial fibular nerve. Superficial fibular nerve about the area of the superior extensor retinaculum will translate into medial dorsal cutaneous nerve, intermediate dorsal cutaneous nerve. Sural will become lateral dorsal cutaneous nerve, okay? Medial dorsal, intermediate dorsal, lateral dorsal. You see them very clearly in the image from Netter on one of the last slides, okay? Again, you have the deep fibular in here. Deep fibular nerve is running with anterior tibial artery. Deep fibular innervates all the muscles of the anterior compartment, which is going to include tibialis anterior, extensor hallucis longus, extensor digitorum longus, fibularis tertius. Underneath here is extensor digitorum brevis, and you see this little muscle bundle right here. You see the tendon going underneath the tendon of extensor hallucis longus. That's extensor hallucis brevis. The deep fibular nerve is mostly motor. It's going to give off this little cutaneous branch to the skin in between the first and second metatarsals, okay? Fibularis longus is going underneath the foot. But before we go underneath the foot, just to make sure everybody remembers, foot muscles. What's the first layer? What's the acronym to remember the first layer? AFA, abductor digiti minimi. Let's take abductor pollicis off first. Abductor pollicis, flexor digitorum brevis, abductor digiti minimi. Second layer, two muscles, quadratus plantae, four lumbricals. But at this point, you're going to see the tibial nerve split into medial plantar, lateral plantar. Quadratus plantae, four lumbricals. The tendons of flexor hallucis longus, flexor digitorum longus are associated with but not part of the muscular layer, but the insertion of quadratus plantae is into the tendon here of flexor digitorum longus. The origin of the lumbricals, same thing, tendon of flexor digitorum longus. We take that away for your second layer. We're left with flexor hallucis brevis, which will sometimes identify the medial head and the lateral head. I don't care, just as long as if you would give me flexor hallucis brevis over on the table. Over here is flexor digiti minimi brevis. What's the stupid thing with flexor digiti minimi brevis? There's no longus, okay? No longus. And you got your adductor hallucis oblique, adductor hallucis transverse. All right? And that is your layers. In here would be the plantar interossei, and not really visible down here too well would be the dorsal interossei. Everybody good? Questions? Who's hiding back there? Lessa, did you see all that? Mm-hmm. Okay. Everybody good on the foot? Cool. It was fun watching your classmates try and put that back together earlier today. Knee joint. What do we call this tendon here? Quadriceps tendon. What do we call it below the patella? Patellar ligament. Okay? Always orient yourself. Fibula is where?
Lateral.
Tibia is medial. So this is going to be lateral collateral ligament, also known as fibular collateral. Medial collateral, also known as tibial collateral. Condyles of the femur sit on lateral meniscus and medial meniscus. Right here is your ACL. Here you see the PCL, okay? If we flip it back this way without breaking it, here's your ACL, here's your PCL. This thing shouldn't be called a ligament because it's attaching from the lateral meniscus over to the medial aspect of the medial condyle, and that will be your meniscofemoral ligament. Okay? Everybody good on that? Cool. Hip joint. What's this ligament? Two heads to it. Say it? Iliofemoral, because it's attaching from the ilium to the femur. It's also got a stupid name. Y ligament of Bigelow. All right? Y ligament of Bigelow. If that's iliofemoral, what's this? Pubic bone. Pubofemoral. Who said ischial? Me? Now say ischial. No, just kidding. That's ischiofemoral right there. Ischium's back here. Remember, recognize the ischial spine, recognize the pubic tubercle over here, okay? Think in pictures. Last but not least, look through look through that little square cut opening. What do you see? No, what do you see right there? Do you see a ligament? What do you see in that white hole? I don't see a ligament. I see a white screw. Okay? That's not a ligament. That's a white screw. The white screw is in what structure? And don't say the femur. Hold on. Okay? No, the screw is in what structure right now?
Fovea.
What?
Fovea.
Fovea capitis. Dent in the head of the femur. What ligament is in the fovea capitis? I think I heard you say it.
No, I didn't.
I said there was a ligament in there.
There was a ligament.
I didn't know which one.
What's the name of the ligament that sits in the fovea capitis?
Is it ligamentum teres?
Is it, or are you asking me or telling me?
asking, I'm
You're-
not
Ligamentum teres, also known as ligament of the head of the femur. It attaches from the head of the femur to the acetabular fossa in the center of the acetabulum. So if my thumb is the acetabular fossa on the inside, that ligament is going to be attaching to my thumb pad. Okay? It also helps to prevent this, the femur from dislocating in the end. These are some pretty strong ligaments. Bo Jackson had to really tear the hell out of his hip joint. Bo ended up with what's called avascular necrosis of the hip joint. The impact was so bad, it destroyed the blood vessels going into his hip joint. The hip joint died, which is why he had to have a hip replacement. But then that sick human being came back to play Major League Baseball with an artificial hip. You want to talk about a freak of an athlete? He is number one and number two. If you ever get a chance, watch the 30 on 30 on ESPN about Bo. He was absolutely gifted, a remarkable athlete. Okay? And he's just a big funny dude. He's a joy to watch. Okay? Oh, one other thing. Forgot that. Tendon of fibularis longus. Underneath the two retinacula, where is it going? Ooh, it's going underneath the foot. That's a jet, that's not thunder. It's going underneath the foot to go to the base of the first metatarsal with your tibialis anterior muscle, which is right here. It is running in a sulcus in one of the bones of the foot. Which bone? Don't guess. Which bone? You were going to say cuboid? Are you guessing or are you thinking?
Both.
Both. Guessed right for a change. Okay? Here's little toe, so that's lateral. Tendon comes down like this, comes around, goes right in there, in that sulcus in the cuboid to attach over here to the base of the first metatarsal. Looks just like that.
You said that's fibularis longus?
Fibularis longus. Brevis is stopping right here on the base of the fifth metatarsal. This is going underneath to the first metatarsal. Okay? Marvin, take a look at this. See that?
Yes.
Okay, don't look down. You're not going to find anything on the desktop. Okay? Everybody good? Cuboid bone. Everybody remember that. And you've also got the sustentaculum tali, which was on your checklist, which is right there. Tendons of flexor digitorum longus, no, flexor hallucis longus and tibialis posterior are running in there. Oh no, just flexor hallucis longus. My mistake. Okay, right there. Everybody good? Cool. I put these in color. Make it easier for everybody to remember. What do we got back here? Achilles tendon. Okay, Achilles tendon right there, clipped off. On the side here, these are your two fibular tendons, right here. Fibularis brevis is going to the base of the fifth metatarsal right here. Fibularis longus is running underneath this ligament here. Anybody remember what that ligament it is? It is not the plantar aponeurosis. Plantar aponeurosis would be like this.
Long plantar?
Exactly. Long plantar. And if we got a long plantar, what's going to be underneath the long plantar? Short plantar. Also on your list is this ligament right here under the paperclip.
Spring?
Spring. What's the proper name for spring?
Calcaneonavicular?
Plantar calcaneonavicular. Okay? Long plantar, short plantar, plantar calcaneonavicular. But you can see right here that the tendon is running right in the sulcus of the cuboid of fibularis longus in the cuboid over to the base of the first metatarsal. And you got your superior and inferior fibular retinacular right there. Okay?
Could we call it spring ligament if you were to tag it?
Yes.
Okay.
3 ligaments and the lateral collateral of the ankle. They're all going to have fibular in there in one way or another. This one, anterior talofibular. This one, running underneath the 2 peroneal tendons, is calcaneofibular. This one around the back that's torn a little bit is the posterior talofibular. Okay? Everybody does that every once in a while. Posterior talofibular. The tibia and the fibula are held together partially by the interosseous membrane. But you also saw 4 muscles attaching to the interosseous membrane, so it does dual work. Over here, helping to prevent separation distally will be the anterior tibiofibular. And if we got an anterior tibiofibular, what's around the back? Posterior tibiofibular. Then over here on the medial side, you got 1, 2, 3, 4. This is the medial collateral ligament of the ankle, also known as, I gave you a subtle hint. Who said it? Deltoid, because you got alpha, beta, gamma, delta. There's 4 ligaments that make up the lateral, medial collateral. We're going to have first anterior tibiotalar. We're going to have longer one, tibionavicular, going down this way, tibiocalcaneal, around the back, posterior tibiotalar. Okay?
If that were to be tagged, would you want the individual or just deltoid?
Individual. I will have only 1 pin in something. Got to be individual. You got 4 ligaments here, 3 here, 2 here, these tendons, and these 3 ligaments were on the checklist from week 8, but I put them on the table. Did I put them on the table? I showed everybody on the table. If I tag them, I'll use this probably for that. Okay? Go through them all one more time, make sure everybody's good. Interosseous membrane, anterior tibiofibular, posterior tibiofibular. Tendon of fibularis brevis, tendon of fibularis longus, long plantar, short plantar, spring calcaneofibular. Spring is plantar calcaneonavicular. Okay? Lateral collateral of the ankle, anterior tibiofibular, no, scratch that. Anterior talofibular, posterior talofibular, and calcaneofibular right here. Medial collateral or deltoid, anterior tibiotalar, tibionavicular, tibiocalcaneal, posterior tibiotalar, and Achilles. Okay?
Dr. Hyman, what's the difference, I guess, with these here? Like, how are the fibers different?
Look at look at the direction of the fibers and look at where they attach. Do you see this dark shadow there? Okay? That's your calcaneus. That is your navicular. This one is attaching over here from the tibia to the navicular. This is the anterior tibiotalar because the talus is underneath. Okay? See the shadow? That's the talus. This is the joint between talus and navicular over here. and over here, you see going to navicular as well, all right? But this is tibiotalar, this is tibionavicular.
What about
Okay.
this one here?
What about this one? Which one?
Like
This
these
one?
between
This
those
one
two.
here is attaching to the calcaneus here. Okay? And back here is also the talus. Remember, the talus is the only bone that articulates distally. Okay? The tibia articulates with talus only. Fibula doesn't articulate with anything. The movement of dorsiflexion and plantar flexion is a function of the tibio-talar joint. Okay? And that came out of here.
I think it came from up here.
Okay, from up there. Thank you. All right? Good? Let's push that stuff aside. Hand me those